There are just so many stories that I have to tell you. And I have seen a lot of different people coming to see me, and I am just so grateful that I am part of their lives. You know, we talk together because I'm not here to fix any person, but I'm here to work with my client to identify some of the strategies, medication-wise or therapy-wise, what is really better to help them in going through their daily activities, their normal life with friends, family, work, and whatever hobbies that they like to do. I will tell you, for example, a story of one young lady that I had who had a history of traumatic events that happened early in her childhood, a lot of abuse and growing up in foster care. She didn't have really that much of family environment because of those changes going through different homes. The interesting part that this lady was really resilient. She didn't give up on many things. However, there was just this sense of feeling of she would start something, go to work, or just deal with normal situation life, but she would always have this low energy, not really enough motivation. But at the time, she didn't really know what was going on. Was it really because she had not eaten? Then she realized that maybe there was a need to smoke. So she was smoking a little bit of marijuana. It would help her go through those changes. But still, it wasn't responding. She wasn't feeling optimally functional. And this is what we did. When she came to see me, we went through all this evaluation, getting to understand her background, her childhood experiences, her way of dealing with stress. Then we identified that there was no typically medical problems that were causing the depression. Of course, we went through the DSM-5 and identifying those. Then I realized that she just had a depression. And we talked about this thing. We ruled out all medical problems. Then we decided to start a treatment. And this is a medication very well known among people here. It's called Zoloft. That's the brand name, but the other name is sertraline, which was kind of really effective. And she started taking it, and we did discuss that it may take about 4 to 6 weeks to really see the effect and the response to the medication. Put on medication. After 4 weeks, she came back. She said, "Oh my goodness, I feel like my energy is coming back. Even on the memories and my thoughts are a little bit clearer. I feel like I'm smiling more. I am connecting with people, and my boyfriend is no longer really complaining. He feels like I am back. My job is great. I'm feeling like when I wake up, I am going to work. I'm looking forward to the day. And I don't know what to say. Just thank you. Thank you so much." And I told her, this is the medication that did the job. I was just here to identify those problems and get her on the right treatment. But also, I recommended her to see a therapist. So she was doing both together. She is just great. She's doing very well. She's back to work. I rarely see her now. I only see her every 3 months. Every 3 months, she's doing great and she's happy. So if you're having any depression, any problem like that, please come to Tempe, Amicus Health and Wellness, and come and see me.